Hello, I'm Dr. Mahnoor, and today we will discuss Arcus Senilis. So, how the patient is going to present in this case? The patient is going to be of 60 plus age, and the patient will present with the complaint that he has noticed a ring around his eye. Approach, how are you going to approach this case? You have to go inside, you have to build a very good rapport, and you have to paraphrase, okay? Rapport, and paraphrase. So all that information that you have outside the cubicle, you are supposed to know that information. All right, so you have to go inside. For example, if the information outside the cubicle says that the patient has some concerns, you have to go inside. You have to say, so I see that you are having some concerns and I'm here to talk to you about them. Can you please tell me, how can I help you? All right, the patient will say that he has noticed this ring around his eye. Now you have to ask open-ended question first. All right, open-ended question. You will ask, can you please tell me more about this ring? The patient will say, like, what, doctor? Or either he might tell you something about the ring. Okay, now you have to do OD para of the ring. OD para of the ring. Onset, when did you first notice it? Duration, is it there all the time? Does it come and go? Progression, is it getting better, getting worse? Aggravating and relieving factors, is there anything that helps with it? Anything that makes it worse? This A is anything else. This is your window to ask about red flags and DDs. How are you going to ask about the red flags? You have to ask about vision. You have to ask about which eye, either both of them or just one of them, okay? You have to ask about vision. You have to ask about any eye pain, all right? You have to ask about any headache, all right? These things that you need to ask in all the eye scenarios, okay? And you can also ask about any eye discharge, okay? Now comes the DD part. So in the DD, the most important DD here is glaucoma, and for that you will ask about night vision, all right? And now comes the Meptosa part, okay? Meptosa. Medical history. Do you have any other medical conditions like diabetes, hypertension, or any other medical conditions at all? Are you currently on any medications? You have to particularly ask about steroids here, because steroids can be a risk factor for, it's not glaucoma, it's cataract, okay? So you have to ask about steroid use, allergies, family history, travel history, occupation, social history, and this also stands for anything else. You can ask about driving here. You can ask about, for example, if there is something related to STIs, you can ask about STIs, sexual history and stuff like that. So just leave this A for now. Social history is very much important here. You can say, so you are having this lesion for quite a few weeks now, or quite a few months now. So is it affecting your daily life as well? Okay, who do you live with? Do you live alone? Do you live with someone else? Oh, okay. So the patient is 65 plus. So you have to ask about fever, flaws, basically flaws. But fever is a must here. Rest of them, it's fine even if you do not ask about them. After this, you have to do eyes. You usually forget to do eyes, but it's better if you do that. Okay. Apart from this, is there anything else that you are concerned about? Ideas. Can you please tell me if you have any idea what could be the cause of it? This is very important, guys. A lot of information patient is going to give you if you do eyes in a proper way. So along with Meptosa, of course, you have to do DESA as well. After that, eyes. And after eyes, you will be doing examination. The examination in case of eye scenarios include, I'm going to write the examination part here, include visual field, visual acuity, fundoscopy, eye pressure, all right? Visual field. You have to mention about vitals as well. I will be checking your blood pressure, your pulse rate, your respiratory rate, oxygen levels in your blood, and along with that, I will be doing an eye exam in which I will check how far you can see, which is visual field, how well you can see, which is visual acuity, the back chamber of your eye with the help of this instrument called fundoscope. I will be checking the pressure in your eye with the help of an instrument called tonopin. Okay, you can use tonopin in the GP. Presentation done, approach done, examination done. Now you have to explain the diagnosis to the patient. How are you going to do it? So, Mr. X, based on what you have told me and based on my examination findings, you were right. I can notice a ring around your eye. You have to explain your findings. All your examination findings are normal, your BP, your pulse rate. But yes, I can see a ring around your eye, okay? I can see a ring around your eye, and based on what you have told me, I'm suspecting that you can have a condition called Arcus Senilis. Give a pause. And now you have to explain what it is. The patient can say, what, doctor? Is it something serious? You have to acknowledge first, and then you have to reassure. Acknowledge, I see that you're worried. I understand that medical terms can be scary at times, but don't worry. It's not a serious condition. Acknowledge and reassure. It's not a serious condition. It's not going to affect your vision. All right? And then explain. Let me explain it to you. Let me explain what it is. So it is a condition. What happens in this condition is that the blood vessels around your eye, they get increased deposition of fat, increased fat deposition. It's normal age-related process and it's very common. Above 60 years, it's present in about 60% of people, whereas above 80 or 85, it's almost present in all of them. Almost 100% of people are going to have it, okay? Now comes the treatment part. In the treatment part, you just have to reassure the patient. Reassure the patient. So regarding treatment, Mr. X, there is, as I have mentioned earlier, that it is a normal process and it's present in about all of the people, in most of the people of your age, or in all of the people of your age. So no treatment is required for it, as it's not going to affect your vision. Okay, the patient might ask you some questions. Question number one, so is there anything else I can keep? Okay, the patient can ask you about his vision. The answer to this you already know, right? So the other question that the patient can the concern about the patient can be about aesthetics. Aesthetics. For that, you can advise the patient to use contact lens. Easy peasy, right? Contact lens. All right. Okay, it's done. When you are explaining the diagnosis, make sure the patient understands. After explaining what it is, after the pause, after explaining the diagnosis, ask the patient, do you understand that? Do you have any questions? Okay, done. You have to check patient's understanding, all right? Reassure the patient, okay? Answer his concerns. Then say, is there anything else I can help you with? Ask the patient if he has any other concerns. All right, so treatment is done here. Now, you have to end this scenario by doing safety netting, and giving patient leaflets. Thank you so much for coming here today. You can go home now, but if you feel like you are having any vision problems, any severe headaches, or if you feel unwell, come back to us straight away. Okay, safety netting is done. Now, leaflets. Before you go, Mr. X, I will be giving you these leaflets. I will be giving you a few handouts about Arcus Senilis. You can read about Arcus Senilis in these leaflets. Okay? Thank you so much. Take care. Take good care of yourself. So nice to meet you. Bye-bye. Thank you so much for watching this video. If you like this video, give me a feedback and I will try to make such videos in future as well. Thank you so much. Bye-bye.